Hello everyone, welcome back to UWorld's live NCLEX review. My name is Nicole, here with another question drill set. If you're new here and don't know how a question drill set works, well, welcome in. A question drill set is fun, easy, interactive things that we do every week, welcome back multiple times a week to get you in a better practice to answer these NCLEX style questions. I will pull up a question up above me, give you about 30 seconds to review it and the answers, and then drop down in the comments why you think the right answers are right and the wrong answers are wrong, and the correct answer of what you think it is. Then I'll go over why the rationales are the rationales that they are, and give you maybe some key hints versus or things in the word, things in the question of how to get to the right answer, basically. So today's topic is prioritization. So all the things priority, first, initial, things that you should be honing in on to see maybe some life-threatening things, expectations versus complications. So I'll give you TID points along the way to answer these prioritization questions. We have Nurse Samantha in the chat moderating for us today. So if you have any questions, send her a little comment in the chat and she will be able to answer it easily. I also like to talk to you guys in the chat, so don't be afraid to get chatty in there. At first, I have some points, some prioritization tips of how to answer these questions as we go along today. So like I said before, these questions will usually have the words first, immediately, priority, and they're usually always bolded on your NCLEX and in our questions as well, to kind of have your mind hone in on those key specific words, kind of make you geared towards the right answer. So when we're doing prioritization, always look for your ABCs first, your airway, breathing, and circulation. Then after you assess that, and maybe some of the answers go with ABCs, or if they don't go, then you can go into the next step, which is safety and infection. And you follow your Maslow's hierarchy of needs when you do that type of assessment. If it doesn't fall under any of those, you use your nursing process. So assessment, diagnosis, planning, implementation, evaluation. Again, in that order. Order is a very important thing with prioritization questions, because you might have multiple of the right answers in the answer choices. But if you don't go in order, then it would be the incorrect choice. So make sure you go in order. ABCs, safety, infection, Maslow's hierarchy of needs, nursing process, in that order, and then prioritize them up against each other. So like I said, if you have multiple of the right answers, use them against each other and make sure you put them in the right order to get to the right answer. So without further ado, let's get started on the very first question. The nurse has received information about assigned clients. The nurse should first assess the client with what? Option 1, peptic ulcer disease, who is reporting stool with coffee ground appearance. Option 2, diabetes mellitus, who is scheduled to receive metformin now. Option 3, heart failure and 2+ peripheral edema, who is currently eating lunch. Or option 4, bacterial pneumonia, who's disoriented and diaphoretic. Let me know what you guys think in the chat. Someone said, explain the process of an RN in the U.S. Maybe you're talking about like the nursing process. So ADPI, assessment, diagnosis, planning, implementation, evaluation, in that order. So let's see those answer what you guys think for this one. Also, shout out to Mount Sinai. I don't know if anyone is here from Mount Sinai, but they used that link on uworldnursing.com, which is Book a Clexpert, and they requested us to come do a lecture with them at Mount Sinai. It was a live NCLEX, a private live NCLEX review. So you guys could be advocates for yourselves to have us come do a live lecture with your nursing cohort at all, or altogether. Just go to uworldnursing.com and do Book a Clexpert, and then you can have some but a cohort of NCLEX review session with us personally, and we would love to do that for you guys. So shout out for Mount Sinai for being the first university for us to do that with, and I hope there's many more to come. I see lots of good correct answers in the chat. And someone said, is the bed alarm on? That is very valid. It is correct. Option number 4, that bacterial pneumonia who is disoriented and diaphoretic. So again, with the answer choice, we're looking for first. If we can only assess one person and possibly save their life, this would be option 4, that bacterial pneumonia who is disoriented and diaphoretic. So we're thinking with this, we're having breathing problems. Bacterial pneumonia is a respiratory diagnosis. And then when you add disorientation and diaphoretic, that means the brain isn't getting the oxygen that it's needing, which is giving us those symptoms. So in our ABCs, A, B, this would correlate with one of those two. Options 1, 2, and 3 are incorrect. Option 1, peptic ulcer disease, who is reporting stool with coffee ground appearance. Again, like I said before, we got to work in order. So option 1 would be a correct answer in the sense that it's the C in our ABCs. But if we don't go in the correct order of airway first, then we're choosing the wrong answer. So our option 1 has C with the circulation, peptic ulcer disease reporting stool with a coffee ground appearance. That's like showing us that we're having some type of GI bleed. Since it's not bright red frank blood, it's a little bit lower on our list. Coffee ground means it's higher up in our GI and it's being digested out, giving us a little bit more time to assess the other clients first. Option 2, diabetes mellitus, who's scheduled to receive metformin now. Again, not a priority. Metformin is a long-term treatment medication. It's not going to be a fast-acting type of blood sugar control, so it can wait a little bit. And then option 3, heart failure and 2+ peripheral edema who is currently eating lunch. This is an expected finding for someone who has heart failure. They might have the peripheral edema, and we're not having any immediate need or intervention being needed at this time. So not necessarily the correct answer for this one. So option 4 is the correct one. Next question. The nurse is in the emergency department, has collected information about clients waiting to be seen. The nurse should first assess the client who has what. So again, use our multiple step process, ABCs, Maslow hierarchy, and the nursing process. Are we option 1, epitaxis and takes aspirin. Option 2, dysuria and takes tamsulosin. Option 3, vomiting and reports frequent loose stools. Or option 4, persistent cough and reports night sweats. Let me know what you guys think down in the chat. Also, let me know if we have any recent NCLEX passers or anyone scheduled to take their test coming up soon or anyone waiting on their ATT. I would love to give you a shout out, wish you the best of luck, congratulations. Or if you maybe just got a job offer, I would love to say congratulations to you too. So drop down in the chat any recent NCLEX passers or schedulers as well. Oh, and I'm also loving y'all's rationale. Big Fine is taking their test tomorrow. Good luck, good luck. You got this. Get a good night's rest. You're going to do great. K. Marie is taking her NCLEX soon. Peterson's taking theirs next week. You got this, guys. Y'all are going to do great. Thanks for tuning in. Maddox is waiting for her or their ATT. And I'm seeing lots of correct answers and rationales, which is always good. You guys are right on it. It is option 4, that persistent cough and reports night sweats. Like you said in the chat, this client is keen towards something maybe like tuberculosis, which is a priority because we need to isolate them so they don't infect other people around them. So we need to put them in an isolation room. This is another type of airborne infection, so it can easily be given to other people. Option 1, the nosebleed, epitaxis, and takes aspirin. This is an expected finding because aspirin is an antiplatelet medication. Dysuria and takes tamsulosin. This medication is given to clients with BPH to relax the muscles in the bladder and the prostate to make it easier for them to urinate. So dysuria could mean an infection, maybe UTI, but it could also be an expected finding with the BPH. So not a necessity and an immediate intervention at this point just yet. And then option 3, vomiting and reports frequent loose stool. This sounds like just normal gastritis. It's not one of our ABCs, so it can wait a little bit longer. But that persistent cough and reports night sweats, this would be the second step of our kind of step order of how we do prioritization with the ABCs, but then safety and infection next. So this is safety and infection. Got to isolate them as soon as possible. So good job, guys. You got that one easy. Next question. The nurse is caring for assigned postpartum client. The nurse should first assess the client who has what? Option 1 is rating incisional pain as 7 on a scale of 0 to 10. Option 2 is reporting pain with urination 3 days after a cesarean birth. Option 3 has a boggy uterus and is passing a large amount of lochia rubra. Or option 4 has warmth and erythema of the right breast and a crack on the nipple. Let me know what you guys think in the chat. Y'all are on it today. Y'all are quick with the answers and quick with your rationales. I love to see it. Good stuff, good stuff. While some of you other people are putting in your answers, I would like to do another shout out for conference season coming up very, very soon. I think it starts next week for some of us. We have FNSA in Florida. So you have Nurse Jasmine and Nurse Samantha that's going to be at that in Orlando. Say hi to them. Go see our UWorld booth. Don't be shy. Then we have NSNA the next weekend in Columbus, Ohio. That's where pretty much the entire team will be there. So we would love, love, love you guys to come say hi at our big booth. Come to our live lectures that we will be hosting there at NSNA. Love to see you guys there. Then I will also be at the next week at CNSA in San Diego, California. So I will see so many of you guys there in San Diego. I hear that one is a lot of fun. And then we're finishing up at SNAP in Harrisburg, Pennsylvania. So make sure you sign up, go to some of these conferences. It's great, great, great connections for later on, maybe in hospital systems, or even getting these like resources and test prep and meeting us in person. That's always nice as well. So hope to see you guys at one of these many conferences. If not, again, book a Klexberg on our page at uworldnursing.com. So, correct answer for this one is option 3, has a boggy uterus and passing a large amount of lochia rubra. I saw a lot of you guys in the chat say, massage the fundus, and that is so true. OB is not one of my fortes at all, but the one thing I do remember from nursing school and OB lecture is to massage the fundus. If one thing's for certain, if you have a boggy uterus, you need to massage it because that uterus needs to contract to get all that excess blood out of the uterus, and it's supposed to dissipate and slow down. The bleeding's supposed to slow down after a couple of days. So if they're still passing a large amount of lochia rubra, that would be very concerning that they might be postpartum hemorrhaging, which would be another medical emergency. So this would be our first client that we go see. Option 1 is rating incisional pain as a scale on a 7 on a scale of 0 to 10. This is unfortunately to be expected, especially with a cesarean section, a C-section. It's an incision. It's going to be painful. But we can give pain medications for that. Pain is not the priority in this case. Option 2 is reporting pain with urination 3 days after cesarean birth. Again, this is something that we might want to be looking for afterwards, after we do the ABCs for infection. It might be a UTI, or if they had a cesarean birth, they might have had a Foley catheter, which can irritate the urethral walls and cause some irritation. But not a higher priority than our ABCs. And then option 4 has warmth and erythema of the right breast and a crack on the nipple. This is just cueing for mastitis. Again, not a huge priority over that boggy uterus. Massage the fundus. Remember that. Okay, the nurse in the emergency department is caring for assigned clients. The nurse should first assess the client who has what? Option 1, fever and a cough productive of green sputum. Flank pain and is reporting hematuria for the past 3 days. Option 3, photosensitivity and is reporting the worst headache of my life. Or option 4, swelling and limited flexion of the left patella. Excuse me. Let me know what you guys think in the chat. Someone said I passed my NCLEX on the first attempt. Congratulations to you. Welcome to the RN life. That is amazing. Awesome, awesome. Also, since we're halfway through, I can ask my favorite question, which is, where are you guys tuning in from? I love to see how far you world reaches in the world. So drop in the chat where you guys are tuning in from. Are we more domestic today? Are we international? This morning we had a lot of international people. So let's see. We have Texas, Ohio, Orlando. Or are y'all just saying all the places that we're going for conference? Those are the 3 places. Philippines, Louisiana, Georgia, Detroit, Jamaica, Nairobi, London, Long Beach, California, Finland, Alabama, San Francisco, Rhode Island, New Jersey, California, Uganda, Oregon, Egypt, Ghana, Kuwait, Zambia, Austin, Ontario, Ghana, South Carolina. How about Maryland, Toronto, New York, people from all over. Thank you guys so much for tuning in. I truly, truly appreciate you guys when you're interactive in the chat, but also tuning in from wherever you are, no matter what time it is. Thank you guys. I hope that you're getting some good NCLEX review with our resources in these question drills. If not, we have a lot more resources at uworldnursing.com that you can be a part of. So, correct answer for this one is option 3, photosensitivity and is reporting the worst headache of my life. So this headache is a common presenting symptom for clients with increased intracranial pressure. So this is life-threatening because our brain is encapsulated in our skull, and if we're swelling, our brain can only swell so much, and that's causing that headache. And that intracranial pressure is just getting worse and worse and going to cause more and more problems, if not seizures and possibly death. So we need to intervene immediately with that photosensitivity and that severe headache. We're already on the latter side of this intracranial pressure, so we need to do interventions as soon as possible. Option 1, fever and cough productive of green sputum. This is a respiratory infection. Yes, with ABCs, it's an ABC type problem because it's a respiratory problem, but we can't add to the situation. They're not having any diaphoresis or they're not having any hypoxia. So we're just taking the simple symptoms of fever and a green productive sputum, not a higher priority than intracranial pressure. Option 2, flank pain and is reporting hematuria for the past 3 days. This could be indicative of pyelonephritis. So we have that infection or possible infection, but hematuria, blood in the urine, and flank pain, those coincide with pyelonephritis, not a high priority at this point. And then option 4, swelling and limited flexion of the left patella. This could be possibly a torn ACL, but again, a musculoskeletal issue, not necessarily an ABC problem or an intracranial problem that could lead to death very, very soon. But you guys did pretty good on that one. Question number 5. The nurse is assessing a 2-day-old client with tetralogy of Fallot. Which of the following findings would be a priority to follow up? Option 1, decreased oxygen saturation. Option 2, tires easily during feedings. Option 3, sleeps in 2-hour intervals. And option 4, systolic heart murmur. Let me know what you guys think in the chat. Don't make fun of me and my mispronunciation. It happens to the best of us, okay? Some people are laughing in the studio, but it's fine. Anyways, how do you guys like to study? We have a lot of fun resources on uworldnursing.com, whether it's question of the week, whether it's question of the day, whether it's lectures, flashcards. We have so many resources for you guys to get ahead of your NCLEX and get better prepared, become more confident as you go into your NCLEX. So let me know how you guys like to study. I see lectures, listening questions, practice questions. I use UWorld practice questions. Lots of lectures and questions. Oh, someone says, I like making my own study guides. That's very good. So then you can personalize it to yourself. Application-based questions. Lots and lots of questions. Well, good for you. UWorld has over 2,000 questions in our question bank. So go to uworldnursing.com, get your own subscription so you have the plethora of practice questions that you could ever imagine. We also have flashcards on there too. So if you want to go see the flashcards, or you can create your own study guide based off of maybe the topic or the subject that you're focusing right now, or you're going through in nursing school right now, you can customize it to you specifically and create your own study plan. Someone asked, do you guys have case studies on UWorld? Yes, we do. We have all the NGN type questions. You can even filter it to just traditional questions like these, or select all that apply, or you can just quiz yourself on next gen type questions. So case studies, you have the matrix, you have highlight type questions, everything that you would see on the NCLEX, you can see at uworldnursing.com. Okay, correct answer for this one is option 1, that decreased oxygen saturation. So yes, like we said, and someone said in the chat as well, we're looking for the ABCs, airway, breathing, and circulation. So this would be our B, our breathing, decreased oxygen saturation. So tetralogy of Fallot is a congenital heart defect, and it's characterized by pulmonary stenosis, right ventricular hypertrophy, and overriding aorta. So all of these things within this baby's heart is all messing the blood flow within the heart, getting oxygenated blood and deoxygenated blood. It's kind of like mixing together. So with a decreased oxygen saturation, that means more of the unoxygenated blood is getting past and getting through to the distal parts of the body, or to the rest of the body. So we need to intervene as soon as possible, give them oxygen, maybe get them ready for surgery so we can fix this and patch this up. But hypoxemia is always our A, B, C, and our biggest intervention. Option 2, 3, and 4 are all expected findings actually of this diagnosis. They do tire easily during feedings because they have to coordinate breathing and sucking, and that's a whole reflex within itself, but also with the mixing in the blood in the heart. Option 2, sleeps in 2-hour intervals, an expected finding for someone with this diagnosis or just a newborn in general. They sleep very, very frequently. And then option 4, systolic heart murmur. This is another symptom or characteristic of triage of Fallot. So not a complication and not something higher than a decreased oxygen saturation. So you guys did very, very good. Question number 6, the nurse enters a client's room and observes that the client is diaphoretic, lethargic, and disoriented to place and time. Which of the following actions would be a priority for the nurse to take? Option 1, administer IM glucagon. Option 2, administer IV regular insulin. Option 3, prepare the client for a CT scan. Or option 4, obtain a capillary blood glucose level. Let me know what you guys think in the chat. Someone asked if the NCLEX is hard. It is catered to you, actually. The NCLEX is an adaptive test, so the harder it may seem for you, that actually it might mean that you are doing very, very well, since it adapts per question. So the harder it's getting, that means the better you're doing. The easier it gets means that you might be getting easier questions because you might be getting them wrong. But we have a whole bunch of test-taking strategies, and we do lectures on these test-taking strategies and explain CAT testing in general. All you got to do is book a Clexpert at uworldnursing.com, and we can go into the nitty-gritty of and really explain the NCLEX itself. So lots of resources for you guys at UWorld Nursing. Hint, hint, we can help you guys pass the NCLEX on the very first time. I see it's pretty unanimous in the chat with this answer. Love to see it. Good job, guys. Y'all are all right with option 4, obtain a capillary blood glucose level. So this question doesn't have to do with our ABCs. It doesn't, have to do with our Maslow hierarchy of needs or even safety or an infection. It's our very last process with the nursing process. So ADPI, you always want to assess first. And even though we have a lot of assessment in the situation or in the scenario of the question, we need to assess a little bit further, because if we do one action, which is this one is keen, whether it's or we're trying to figure out if it's a hypoglycemic event or a stroke, we need to know which one before we do our next intervention. So obtaining a blood glucose level is a quick intervention that we can do to really assess whether it's a hypoglycemic event that's making our client diaphoretic and lethargic, or if that comes back normal, then we can move to our next step of flow and do a code stroke. So assess, and obtaining a capillary blood glucose level is another step in our assess. If we were to do any of those other interventions and didn't assess the blood sugar, we could have misdiagnosed the client. So always assess for safe and expected findings of what the situation is. So good job, guys. Question number 7. The nurse in the emergency department is assessing a client who has full thickness 4th degree burns to the torso and upper extremities. Which of the following findings would require immediate follow-up? Option 1, singed nasal hair. Option 2, presence of eschar. Option 3, 3+ edema of the upper extremities. Or option 4, decreased sensation over the burn areas. Let me know what you guys think. And yes, these question drills are posted up on our page towards the end of the day, or you can visit us on YouTube and then you can type in the specific topic that you are looking for. I find that the easiest way to narrow down, like if I want cardiology or peds or OB, but we do post them on our page towards the end of the day, just so we're not giving the answers out earlier for the people who watch in the afternoon rather than the morning. Good job, guys. I'm seeing lots of 1s and 3s and seeing some good rationales as well. Perfect, guys. Okay, correct answer is that option 1, that singed nasal hair. So going back to the question, you're assessing someone who has full thickness 4th degree burn. So they had been in some type of burning situation, a lot of smoke, a lot of extremely hot air that could have singed their nasal hairs. And that singed nasal hairs is indicative of internal bleeding or internal burning that could be happening. So this would require intervention just to protect the airway and prevent any further complications of airway and breathing. Since that singed nasal hair is like the entry point for our airway and breathing, we need to assess and intervene immediately. Options 2, 3, and 4 are also probably expected findings. The presence of eschar, that is that thermal energy, the black stuff from an extensive burn. So that is an expected finding. +3 edema of the upper extremities. Again, another expected finding. We have third spacing that happens as we try to compensate with all the fluid in our body. So that is another expected finding. And then option 4, decreased sensation over the burn areas. A 4th degree burn is a full thickness burn. So we're burning a lot of those nerve endings that are towards the higher end of our thickness in our burn or in our skin. So if we have 4th degree burns, we probably have burned off a lot of those nerve endings, which means you're not going to have those sensation feelings. So decreased sensation is an expected unfortunate finding in this case. But you guys did very, very good. Last question of the day, question number 8. The nurse is caring for assigned clients. The nurse should first assess the client who has what? Has pneumonia and a temperature of 100 degrees Fahrenheit, has cellulitis of the right lower leg and a heart rate of 130 beats per minute. Option 3 has ulcerative colitis and severe abdominal cramping. Or option 4 has a history of a stroke and is unable to lift the arm of the affected side. Let me know what you guys think. Someone was asking in the chat, What days do we go live? We go live multiple times a week, multiple times a day. We go live on Tuesday at noon with a lecture. We go live Wednesday at 11 a.m. and 7 p.m. with a question drill. We go live Thursdays at 11 a.m. and 3 p.m. Central Time. These are all Central Time. Live on Fridays and Sundays at 7 p.m. Central Time. So multiple opportunities for you guys to tune in and get live free resources, live free lectures, question drills, be in the know with everything NCLEX related. You could also visit us at uworldnursing.com. We have our whole events calendar there, so you can see the next couple of weeks what topics that we're covering and the specific times that we're covering those as well. So check us out there. I'm seeing lots of 2s and 3s for this answer. Mostly 2s, some 3s. I'll take it. And Miss Tequila Rose is correct with thinking that it is gearing towards sepsis. This is totally true. Option 2 has cellulitis of the right lower leg and a heart rate of 130 beats per minute. So we have a confirmed infection, and then we have a heart rate of 130. So sepsis is when you have at least 2 criteria of a multiple bundle. And sepsis can quickly turn into septic shock and be very life-threatening to the client. So we need to intervene as soon as possible. That heart rate of 130, just because you have an infection, your heart rate shouldn't be elevated. So those two together are going to be making it our first client to assess. Option 1 has pneumonia and a temperature of 100 degrees Fahrenheit. This is a low-grade fever, so it is an expected finding for someone who has an infection. So no, not necessarily no need to intervene, but we can intervene a little bit later on. Option 3 has ulcerative colitis and severe abdominal cramping. This is an expected finding with ulcerative colitis. You have that motility in the stomach from an abnormal stomach peristalsis, so that severe abdominal cramping is expected. And then option 4 has a history of a stroke and is unable to lift the arm of the affected side. Again, this could be an expected finding because this could be the residual from their stroke. So no need to intervene there, but that cellulitis and a heart rate of 130 beats per minute, this is indicative of going towards sepsis, going towards septic shock, and going towards more problems, which we don't want. But you guys did so good today. Thank you so much for tuning in. I hope you learned something. Hope you got some points to figure out how to get these prioritization questions better and to be more confident with answering these questions, because they can be a little bit tricky since not all the answers could be wrong. They could all be right, but you got to get it in the right order. But if not, we will have more and more practice in the next coming week, so just stay tuned. Until then, I will see you guys next week.